Welcome back to OpenLine. I'm Chris Davis. If you're just joining us tonight, we are talking all things pandemic, where we've been, where we're headed, and just kind of the journey that we've all been on the last 2 years. We've been focusing a lot on vaccines with Dr. Spyros Kalams from Vanderbilt University. Doctor, I don't think you could get into this conversation without talking about, there's obviously been vaccine hesitancy. How, from your perspective as a medical professional, have you, I'm sure you've even had probably some conversations within your own personal life about people that may have been hesitant.
Absolutely. I am optimistic about the numbers. I mean, despite, I think the people who are truly, the anti-vax crowd, I know there's a spectrum. There are some people that are genuinely fearful of technology and vaccines or needles or whatever it is, and some people that use it as some kind of, I don't know, some kind of tribalism thing that I don't think I'll understand. But if you look at how many people in the most vulnerable groups, like 65 and older, who've had at least one shot, I think we're approaching 80–90%. So, the message is getting out, and whether those people are getting their vaccines because they finally are realizing, maybe everybody around me is kind of right, a couple of things. One of my technicians in my lab, his mom was just absolutely terrified, and finally she says, "All right, I'm going to do it. Will you hold my hand?" And he did, and he went with her, and everything was fine, and she did very well. And I had another a member of my group say, my mom is very hesitant. She just doesn't know. She's scared, and what could you do to tell her? And I tried to just tell her that, look, my mom is 86, and she's a nurse. And growing up, she told me that when she went to nursing school, she took care of polio patients. So this was in the 50s, and as soon as the polio vaccine was available, everyone just dropped everything and went. They just couldn't. She did take care of people in iron lungs, and as a kid, I said, what is an iron lung? We didn't have ventilators. That's how they got people to breathe. So she's, in a way, she's like an inspiration for going into vaccine work. And so when I call her, she just says, I got my shot. When's the booster? I'll line up. But anyway, I told this story to my friend's mom and said that my 86-year-old mom did it. She got her booster. Her friend got it. They're fine. And then that kind of, on a one-on-one basis, said, oh, okay, this can't be bad. I wouldn't recommend something to somebody if I wouldn't recommend it to my own family. So that's kind of way. Rather than try to beat somebody over the head with facts, I think sometimes those one-on-one conversations help a little bit more. It's so tempting to try to scold somebody, or it doesn't help, even though it might make you feel good in the moment sometimes. So I just try to convince them. Vaccines have done more to stop illness and death than anything, right? More people have died by infectious diseases than by wars, if you total it all up. It's hard to argue against them in any way.
And it's been my experience, whether it's between stories I've done or even people within my own life, usually it's been the people that have been most directly touched by somebody who has had a severe illness, or maybe it was them themselves that have seen the ramifications of not taking it seriously, that that really can change your perspective on it.
Yeah, and so it may seem odd to say, well, how are you so cloistered that you don't have a friend or a loved one, or I think we've heard stories in the hospital about people who typically are unvaccinated wanting the vaccine when they're about to go on the ventilator, and I wish it worked that way. But there's no one-size-fits-all for how you convince somebody. Some people are convinced by the facts and data and publications, and it's not just one group saying it, it's multiple. And it's not just the randomized trials, it's the worldwide observation. And we have vaccines that are incredibly safe. And I'm not saying that there aren't side effects from some vaccines. You always have to balance it to what's happening with the infection. If we had no COVID at all, anywhere, and we had this vaccine, and I said, well, I might get a fever for a day, I'm going to skip it. Well, that might be the right choice. But, in the middle of the pandemic, when there are people filling up hospitals, that was not the right decision to make. Now, maybe we'll get to the point where routine vaccination may not be required or recommended. I think we're far away from that. If you haven't been vaccinated, I would still do it. I mean, it's possible you have had some infection. It's possible you have some immune response. It's safe. If you haven't done it, I would still do it now.
Absolutely.
Yeah.
I want to bring Carolyn into the conversation. Thanks for waiting patiently, Carolyn. Go ahead. Welcome to OpenLine.
Yes, thank you. My question for you all tonight, and thank you for this opportunity, is since I work in the healthcare field at Life Point Health off of Old Hickory Boulevard, I was wondering if someone has not had a booster, how will they be most likely to keep from getting sick?
Awesome, Carolyn.
Okay.
Thanks so much.
Yeah. So they've had their vaccine shot but have not had the booster. Well, I would highly recommend they do. I mean, I think. So first on the vaccines, I think it bears repeating that Omicron's different enough that I would almost maybe. I'm not going to change the nomenclature, but some of my colleagues said we shouldn't call it a booster. We should call it a third vaccine. And, again, getting into just linguistics here, but the 3-shot series against Omicron gives you that 90+% protection that you would have had if you had 2 shots against some of the earlier variants, right? So if you haven't had your booster yet, I would highly recommend it. If not, I would do all of the other things that have been recommended, certainly masking, trying to stay away from crowded situations, because all of those rules still apply. I mean, if you and your associates are wearing masks, it's like I would call it like a Swiss cheese, right? Nothing is 100%, but you get whatever it is, 50%. You add those reduction in risks and you can make a difference. So get your shot. If not, I don't know why you're not, but it's free, it's easy. The side effects don't accumulate. That's another thing that a lot of us have noticed. If some people feel terrible after the shot, so they get fever. I had no symptoms whatsoever. Other people might have had symptoms after the first shot, but not after the second or third. So it's really hard to find any kind of patterns with it. Even when you look at all of the data, the incidence of side effects from the vaccine don't get worse the more shots you get. I don't think any of us really understand what it is about the vaccine that triggers those symptoms. So again, that's my short answer. Get your shot. Otherwise, wear a mask and especially if you're immune compromised, that's a whole different category. There's some recommendations to get a 4th shot. That gets really, it's hard for me to evaluate that. More that data will be forthcoming over the next few months.
While we're on the subject of boosters, and you can tell me if this is just unknown at this point, but do you foresee a future where a regular booster may be necessary, or even kind of like a flu shot?
It could be. It could be. I mean, I think, boy, that question came up right at the beginning of our trial. Do you see this happening? It could. And that's honestly, the CDC does amazing work with surveillance. I mean, that's their job, really. It's to figure out what's out there and look at the landscape. And now it kind of depends on the severity of things, right? So if SARS-CoV-2 truly turns into a seasonal SARS and just circulates and causes a cold in people, maybe not. But if it changes enough, there might be a rollout, and it's possible that we treat it like the flu, right? If you look at how they do influenza, they actually look at what's circulating in the world, and then they make an educated guess as to what's going to be circulating during the season, and that's how they change the flu vaccine every year. So we could get into a situation like that, especially if it's still if it still causes severe illness in some group of people. And again, I don't mind getting my shot yearly either to prevent myself from getting sick or to prevent somebody else from getting sick. And I can tell you, as a physician who takes care of patients, I guarantee you Vanderbilt's going to make me take the shot. That's when, but I don't mind. I mean, that's, you know, I have to take my yearly flu shot. I just think it's part of the job, and you know, so keeping everybody safe.
Sure, absolutely. Our previous caller, Lisa, has called back in and had another question, I believe, that she wanted to ask. Go ahead, Lisa.
Hey, so I wanted to encourage the doctors/scientists to look into the Pfizer data that was released. It seemed like it was.
I'm going to
really
cut you off there, Lisa, just because we've talked about this, saying that you didn't really have, you know, a lot of background in that.
I'll try to see what, honestly, I will try to look this up, to be honest. I mean, people have questions and all, and in case I get it again. But the companies have the amount of data. This is another thing. The amount of data that is generated during a clinical trial is daunting. And even for Moderna, we have monitors on site. The amount of scrutiny is incredible. So. I'm surprised it's as little as 75, whatever that number is. The pages and terabytes of data that are generated are astronomical, and all of that needs to be boiled down and subject to FDA scrutiny and published on very transparent websites. Clinicaltrials.gov is an example, and registered. And so the level of scrutiny for all of these trials is profound. So I can honestly say I doubt there's anything nefarious going on, but I will try to see what the caller is talking about, just to, you know, I have to respect the process. So.
Sure.
Yeah.
And being a scientist, that is the process.
I mean, I think I try, we all have biases, but I try to keep an open mind for all of this stuff, and don't want to.
Sure. I don't feel like you can have a conversation about the pandemic without touching on the impact that it has had on the healthcare community. We've seen lots and lots of stories about healthcare burnout and, you know, in the struggle to be able to keep staffing up. As someone who is in, you know, a frontline hospital dealing with this, what has been some of your experience with that?
Oh, I think when the hospital was full, you could certainly see it. I mean, our cases are going down like in most of the country, but at our level, it was we had task force to take care of these patients, and traditionally, if you need help taking care of a patient at an academic center, you'll get an expert. So they might be on what's the general medicine service taking care, but if they have a specific infectious diseases questions, they'll call one of us, or if somebody has a heart problem, they'll call a cardiologist. But we could not keep up with it. So we ended up having a kind of like we called it a huddle. All of these patients that were in various places in the hospital were discussed at a one-on-one level. We basically had a Zoom call, and at the time, the head of our infectious disease division, Dave Aronoff, used to be on these huddles every day. I filled in for him for 1 week when he wanted to go on a little bit of a vacation. And I just said, "You did this every single day?" He did. I mean, to discuss where patients were, because a lot of times it was how to manage somebody in the intensive care unit, or is this appropriate, or should we give this person remdesivir, or does that person need it? So all of those discussions. So we felt it, and in fact, we were getting emails that you got to be willing to fill in case somebody gets sick and can't do it. So, and that's even at the physician level. And of course, we've heard about the nurses getting burnt out, and you know, absolutely. So we felt it, and we were at capacity for a while during both surges. So.
Absolutely. You know, I feel like a big conversation topic in the managing of the pandemic has been certainly schools and what's appropriate at the school level. Won't ask you to get too far out of your purview here, but as you know, in this, you know, we're in a unique spot where even Metro Schools, which is the last county in our Middle Tennessee area, has decided that now after spring break that they will let students go without masks. A part of the evolving conversation has been about the impact that COVID has had on children. What would be your insight on that?
I think that's such a, I have spoken to my colleagues who have young children. Now mine are college age and above, and they've all had their vaccinations, but the ones with kids in school, I've heard from the teachers who say that even though they've been vaccinated, they don't want to get sick because they don't want to miss school, or they might have somebody at home who's immune compromised. So, and they feel like, I'm wearing a mask, why shouldn't everybody wear a mask? So I've certainly seen that argument. I've seen the kids wearing the masks. So, when I pass by some of the elementary schools, they don't look too sad, but I can't say that. I mean, I'm not saying that it doesn't have a negative effect on it. So I do want to see how it plays out in the schools. I certainly would respect the teachers who feel like, hey, I can't afford to get sick because of any of the things that I mentioned. And as far as kids go, yeah, that's tricky. They still get sick with COVID. They certainly don't get as sick as adults as a rule. But to say that kids don't, children die of COVID as well. And I think a lot of them have been vaccinated. And as far as some of the the problems with the vaccines that are there are some side effects from vaccines, and young boys especially, that might cause some heart issues. However, whatever the vaccine causes, all of the things that the vaccine causes, the virus causes 100 times more. So I think it gets down to that balance, right? So if there's, I'm okay with starting to think about backing off on the mask mandates personally. However, you also have to be in tune to what's going on and be willing to reinstitute them if we see cases going up. I don't think it's fair to have it both ways. So I could see that experiment, and I can see why you might not want to have the masks, but boy, on the other hand, when you look at circulating influenza, we knocked out a lot of respiratory viruses in the past 2 years. And it's not because COVID displaced them. I mean, people weren't getting sick from flu because of all of these masking precautions. So there was a benefit to it, but I can certainly see the desire to not have your kids wearing the masks. So it's not quite an answer, but I think it's cautiously, I think it's okay as long as you're willing to look at the landscape and be willing to say that maybe we should put these on if you start to see cases come up, or if you start to see absenteeism or spread of the virus in school, maybe it's time to put them back on. So again, if you're willing to be flexible like that, I can certainly see the rationale.
Sure, and I should point out, it is optional. That is part of the rule for Metro. Is students are more than welcome to, teachers are more than welcome to if they want to as well. We need to fit in another break real quick, but we will have more right after this.